This is Yoon Sang-yop, Dean of Social Sciences. Today, I will show you photos of what you go through after hypertension surgery. I also asked you a few questions after the surgery. Let me explain about that. There are people who say they are mates after hypertensive surgery. Original. When do our doctors think? The heart is slightly to the left. So, from a very young age, because of the heartbeat, the left side is a little bigger in muscle, bone, even breast than the right side. Now, on average, about 10% to 15% is larger on the left than on the right. So 8 out of 10 people are like that. Of course, sometimes we go, it's a little professional. Really are right-handed professional baseball pitchers. Those people are more developed on the right than on the left. They do a lot of exercise. And sometimes 1 or 2 minutes out of 10 of them are much longer on the right side than on the left side. But in most cases, the left side is 10% to 15% larger. When performing hypertensive surgery, take that into account for the final balance after surgery. Remove the left a little more from the top right, wire and fat anyway. Because they have large bones and muscles, they may eventually have slightly flattened breasts. However, after the surgery, about a week or 2 later, the swelling is still less than half gone. Until then, most of them are actually couples. That's normal. Rather, and later, when you look at the final results, the pairing that was very severe before the surgery is actually more balanced and more similar. Of course, there are people who don't eat bruises at all, but it's a leeway. In fact, in order to properly remove the fat and threads in the breast right under the skin, you have to touch the back of the skin a lot. If you work hard on the surgery, you will get bruises. Capillaries. Very thin vessels burst. The more aggressive the surgery, the more the capillaries actually burst a little. So there are often cases of bruising. If I show you a picture later, I will explain it one more time. Feeling cold after surgery? In fact, in most cases, there are many cases where there is a lot of fat, some or mixed type. Even true leeway is to suck fat because there are peripheral fat. That sterilized water, I put enough of that water with the anesthetic in it. So actually, if we're trying to pull out an average of 150 to 200 centimeters of fat, we're putting in about 600 or 700 centimeters of water. I put 3 times the water. A lot of water comes out during surgery. It comes out together while smoking fat, but there is still a little left in the end. Of course, the water is absorbed and disappears. Sweat and pee and all that. Some of what's left is so it feels really watery. That's normal. Of course, now that feeling almost disappears after a week or 2, and it may be a little there in the second week, but after almost 3 or 4 weeks, the feeling of being wet disappears at all. People who are bumpy or have slightly folded skin, of course, people who are small in size and have good skin elasticity don't really show skin folding. By the way, people who say they are very large, but they are stretched or have gained too much weight, but suddenly they have real skin folds. There's a little bit, most of the time they don't. Your skin may be a little rough. If the actual liposuction is actively carried out just under the skin, the bumps will be severe, of course, if the surgery is too excessive and wrong. Sometimes the teacher who performed our surgery doesn't have much experience yet, so the novice teacher makes it a bit rough, which is actually a side effect. However, most of the bumpy skin folds that are slightly visible during the course of the recovery process appear temporarily and most of them disappear. Shall we do one more last? Nipple sensation problems after surgery. Yeah, a lot of nipple sensation. There is a real way to get rid of it. If this is too large and the membrane is cut 180 degrees and more than 1 centimeter, this is especially good for the skin. There is also a surgical method that cuts the nerve directly. I didn't intentionally cut it. That's because the incision line is too big, so the incision line. Make it very short, and then most nerve direct damage doesn't happen very well. But this is also surgery. Also, this is not just one nerve, it has dozens. So when you have the actual surgery, it will feel a little bit different. Of course, most of them come back. But some people think, director, this is all back. Not 100%, but 80%, 90% came back. Sometimes people say that. In most cases, there is no problem with daily life after surgery, so there is no problem now. But sometimes there are people who feel that things are a little different. Well, it's a year long. After 2 years, everything is fine. Although it has not returned practically completely, the peripheral nerves have supplemented it so that there is no major disruption to daily life. The liver or me is a sensitive part that is very, very important, and I am so worried about it. So in fact, if you are too worried about it from an extreme point of view, you should not actually undergo surgery. This is also the scar problem. But most of the scars, in particular, I don't see people who live in trust anymore, but they actually exist. If you look for it, you can actually find it. The angle may also vary slightly. Realistically, it doesn't interfere with daily life. It doesn't mean it's okay at all. That's why it's so important to you. Actually, the answer is not to have surgery. The first photo after surgery is now the next day. It's bumpy because we put a lot of pressure on things like the abdomen. Actually, it's not that the surgery was wrong. It's because it was suppressed. There can be something like this. There's a little bruise here. We practically use a sponge like this after surgery. I press it, but the area pressed with a sponge does not bruise well. Sponge, where the sponge is best not pressed with the sponge, there may be bruising around the chest, the middle armpit, or the periphery. Normally, these people disappear within 3 weeks. In this case, he is now in charge of gymnastics cases. What happens after surgery? If you eat 3 or 4 weeks, it will all disappear. I'll discuss another topic with you. Thank you very much.